Here at CBS, we're very committed to stopping the stigma surrounding mental health. The World Health Organization says that COVID has created what they call a parallel pandemic when it comes to mental health. A new survey found that U.S. adults have the highest stress levels since April. 84% reported feeling at least one emotion associated with prolonged stress, like anxiety, sadness, and anger. So we asked our Instagram followers to share the first word that pops into your mind when you think about mental health during this pandemic. Their responses include exhausted, lonely, overwhelmed, forgotten. Can I add the word enough to that list, too? Psychiatrist Dr. Sue Varma joins us now. Sue, what would be your one word? I'm curious.
Dumpster fire.
Yeah.
Oh, my gosh. I know. Yeah, that sums it up. So when we talk about these parallel mental health, this parallel pandemic, what is the impact? What does it mean exactly?
You know, we really have to help people address the mental health issues because it affects their ability to be a parent, their ability to be productive in the workforce. We're finding that people are experiencing trauma, and trauma, we could call it with a big T or trauma with a little t in the sense that we've lost lives. There's a lot of grieving going on. Grieving is not only the things that we lost, but it's also the things that we didn't get to have. We didn't get to commemorate important milestones. We didn't get to grieve losses in person during funerals. So we really need to look at the economic impact as well, and I think that that's, really a big part of the picture.
So I think a lot of people aren't really even fully conscious of how deeply they may have been affected by everything in the past year. How do you know the toll it's taking, and how do you give yourself kind of a mental health checkup?
Exactly. So, it's very interesting because, Tony, we've been talking about mental health issues since the beginning of the pandemic, and it goes in waves and it goes in stages. And the more layers of losses that a person experiences, of jobs, economic losses, and then add in the uncertainty, the fact that we thought this was going to be at lockdown in March of last year, a 2-week thing, and here we are almost a year later. So it's really important to understand that there are layers upon to stress, and there's unrelenting stress and chronic stress. And ask yourself a certain key questions. If you can look at over the last 2 weeks to 1 month, how has your mood been? Has your mood been lower than usual? Are you experiencing more anxiety than usual? Are you having trouble sleeping? And are you having morbid thoughts that life is not worth living? The hopelessness and the pessimism, that's one thing that I see setting in people the longer that this goes on.
Yeah, I so agree with Anthony, Sue. I can't wait till they drill down and really look at the effect that this has had on all of us, because we just sort of plow through. But I know that you have some easy, what you call mental health exercises that we can all do, such as?
Yes. And, Gayle, yes, one of them is progressive muscle relaxation. I think that it's so important that people be able to take breaks. So one thing I want to say is take breaks during the day. And this is one easy exercise that you can do 2 to 3 times a day, in addition to having breaks and separation between your work and your home life. So I could say if you could go for a walk, great. And if you can't, this is something that you could do at your desk. And I'm wondering if you'd be willing to try this on, with me right now, and I'd love to have you experiment with it. Progressive muscle relaxation means you sit back in your chair and, look, this is not going to take the place. This is not a substitute for mental health treatment, but these are things that you can do by yourself. So you close your eyes, you settle in your chair, and you let your shoulders relax, and you take a deep breath, and you clench your fists. The idea is that you are tensing and releasing muscle group by muscle group. So
open and close my fist? Is that what you're saying? Open and close my fist?
Open and close your fist. Yes. Yes. So just settle down in the chair, close your eyes. Let your shoulders relax, and then breathe with me. And you're clenching your fists, and they're by your side, and I'm just keeping them up here so you can see, but you're clenching your fists, and then you're releasing them. And then you're clenching them again, and you're releasing them. And you're taking in a deep breath,
what is this doing for me,
nose.
Sue? What is it doing?
And what this is doing, this is relaxing, and this is invoking your parasympathetic system. What's happening is we're all in fight or flight mode. Yeah. We are waiting for the next shoe to drop if the other shoe hasn't dropped. And this is the vagal tone in the body really creates the relaxation, and it says that, like, I'm not in a war zone. When we look at the economic impact, Gayle, I didn't even get to talk about how this is costing the United States $200 billion a year. Absenteeism, presenteeism.
You're right, Sue.
Showing up to work, showing up and not being able to be present.
We can all do that. Close your eyes and open and close your fists. Thank you, Sue Varma. Always good to see you. Feeling stressed right now because I got to go.
We'll be right back.